Well, in the aftermath of the floods in KZN last month, many communities in the province are still battling to get access to clean drinking water. It's affected some hospitals as well, including the Prince Mshiyeni Hospital. Well, there have been reports that water has been restored to the facility. The Public Servants Association says that is not true. Let's talk to the KZN PSA Provincial Manager, Ndlovu. Mlungisi, a very good afternoon to you. Welcome to the program. So, Premier Sikazgalala yesterday at the briefing said that there was an indication given to them by teams that water services would be restored by end of business yesterday. Has that happened yet?
No, good afternoon and good afternoon to the viewers. We were so excited to get the news yesterday that the water at Prince Mshiyeni will be restored. The information that I have received, because we're receiving update on hourly basis. As we speak now, they are still relying on the water tank. You'll recognize that Prince Mshiyeni is one of the biggest hospitals in the province, and also at Mlungisi that service about 1,600 outpatient, and also in hospital there are 800 patients that has been admitted. There's got two reservoirs that accommodate 1 million liters, and the hospital to proper function they need 1 million liters per day, which means the municipality is not keeping up with the pace of delivering water. The challenge that we have now is that, yes, the Premier has spoken to say the water will be restored. We saw the communications from the municipality that the water will be restored, but the water has not been restored. If they are saying the water has been restored, we need proof that it has been handed over to the hospital by environmental to confirm that the water is clean. So it has destabilized the situation. As much as we appreciate the work that has been done by the department in terms of ensuring that there are water tanks, but in a hospital environment that consumed about 1 million liters a day, we need to ensure that we restore that situation, because it has affected the service delivery in the hospital. Taking into account that the department has placed a filling of vacancies in a moratorium. Now they need to have more manpower in terms of fetching water and other things. We appeal to the municipalities as the main service provider of water to ensure that it's restored as a matter of emergency. We also experience the same thing.
Pardon me,
yes?
Just on the one hospital, at the Prince Mshiyeni Hospital, are staff being told why there's not been a full restoration of water services, despite a briefing yesterday by the Premier saying that it would be sorted out by the end of the day?
They are also asking questions, because you'll appreciate that it is the municipality's responsibility to ensure it's restored. When the Premier said it will be restored yesterday, he was excited. But through our investigation and source, it has not been completed. We need the department to communicate when will water be restored. We need municipality to confirm. When we also appeal to them to go and visit at Mshiyeni, as I've said, that this is one of the biggest hospitals that service over 1,600 outpatients. The water needs to be restored as a matter of urgency. We understand that we are in the disaster, but we need to be able to prioritize our hospital. As I was saying, also King Shaka Airport experiencing the same issue of water shortage since last week. This has been communicated to management to say they need to be able to address some of these challenges.
And Mlungisi, I know there are water tanks deployed to the healthcare facilities where there are issues with tap water at the moment. How effective is that? Is there enough water to meet the needs of each hospital, each clinic?
It's not, because as I said, that the department has started a few weeks back to provide still water to employees. It's not enough, and also it's not enough to patients. As I've indicated, they've got about 2 reservoirs. Each need 1 million liters, and most of the Ethekwini district has been affected by this water supply. I know that municipality has restored water in some of the areas. So we need to normalize the situations, because even those water tanks it won't be able to sustain, to supply 1 million litre, but we need about 2 million per day so that you can be able to run about 3 days. So the consumption of water, it's too high in that hospital. So we cannot be able to compromise. It is for this reason, as PSA, we're going to monitor this situation. We call upon our leaders, especially in government, if they say something, they must be able to confirm. Where they are doing right, we give credit, but the issue of water is not being restored, they must be able to prove us.
And do you know of any cases where hospitals or clinics have completely run out of water since the floods?
So what we have noted that after we've communicated with the MEC and HOD, there's been able to provide the water tank, they've been able to provide with still water, which we give credit to that. But as I've indicated, the hospital environment, you need to ensure that you restore the normal supply of water because the consumption level is very high. There was a challenge at Port Epstein. It was sorted where they provided an alternative and also it went there. But the issue of Prince Mshiyeni, it's a big challenge because the influx of communities where they want the services, it's become a problem. And I will understand that, yes, the department does not provide water. Municipality is still working under the clock, but they need to be able to fix it. It's almost 3 weeks now. Where is the problem? There is a communication from the municipality to say it has been restored. We are saying it is not true. You know, we went there yesterday. I was there today to monitor the situation. On hourly basis, we get the report. Let them be able to fix the issue of water. Otherwise, we're going to lead to a serious crisis.
Mlungisi Ndlovu from the Public Servants Association in KwaZulu-Natal. Good to have your time, sir. Thank you.